the notion of medical necessity can be, I'll say, a little bit confounding to trained clinicians, because medical necessity is not a medical term. It's a legal term.
This episode is sponsored by TherapyNotes, therapynotes.com. Be sure and check them out, and be sure and use the promo code Gordon, Gordon, and you can try them out for 2 months for free. Over 15 years ago, when I started my private practice, I had to learn a lot, and most of it the hard way, and I don't think you need to do the same. Hi, I'm Gordon Brewer, a licensed psychotherapist, and welcome to the Practice of Therapy podcast, part of the Psychcraft network of podcasts. Join me in this journey of discovery as we have conversations with other leaders and professionals in both the mental and allied health fields. Join us as we explore both the business and clinical sides of running a private practice. Hello, folks, and welcome to the podcast. This is episode number 361 of the Practice of Therapy podcast. I'm Gordon Brewer. Glad you've joined me, and hope you're having a good December, or whenever you might be listening to this. As I'm recording this, we are full tilt into the holiday season, and I think we just all have just a little bit of change in everything as we go through this season. I know for me, just a different mindset, different rhythms to life, and all of that sort of thing just are much more noticeable. You know, my guest for today's episode is Joe Feldman, and Joe was just a really fascinating guy to talk with, and I really appreciate his passion for helping folks navigate the whole insurance side of things, particularly around mental health issues. Joe became an advocate, and you're going to hear more of his story here in a moment. But, you know, one of the things about running a private practice, certainly if you are a cash-based practice, there is something to be said for that, and there is makes things much simpler for people in running their practice to be fully cash-based and not accept insurance. But there are a lot of practices, like mine, for example, where we're in an area, an economic, economic, but socioeconomically, for the area of the country that I live in, it's really important, I think, for us to be able to offer that to our clients. I live in a small metropolitan area in the Appalachian Mountains called the Tri-Cities, and the surrounding area is a very large rural area. And so a lot of the clients that we get come from a lot of different socioeconomic backgrounds, and they're very much dependent on their insurance to receive services. And so I made the decision several years ago to be an insurance-based practice. And I think you can, not to get too far off on a rabbit trail here, but I think it is very possible to have a profitable and successful insurance-based practice that does well. So anyway, I'll just say that. But anyway, Joe is going to walk us through kind of some of the things that he's learned over the years with problem, and particularly here lately, where a lot of insurance companies are denying claims for mental health services based on lack of medical necessity. And so he's going to talk about that, and I think you're going to enjoy our conversation. You know, one of the things as we move towards the end of the year, if you're like me, you're starting to think about goal setting and just thinking about, okay, what do I want to do differently in the new year? What are things that I'm looking forward to, and that sort of thing. And one of the ways in which I do that is with the use of my planner. I have been a big advocate of the Full Focus Planner for several years. I use it every single day. And it's created by the Michael Hyatt Company. And I'm not going to get too far in the weeds here just talking about that. A paper-based planning system that he's put together. It's bound. It's very nice, very nice quality product. But I'd love for you to go check it out. It's got just a lot of features to it that I think are helpful, particularly for us and particularly for those of us that are really kind of driven by our schedules and our appointments and that sort of thing. And also just thinking about goal setting and being more focused. Again, it's called the Full Focus Planner. And you can check it out by going to practiceoftherapy.com/full focus planner. And just full disclosure, that is an affiliate link or an affiliate landing page, and you can check it out. So I really like mine, and if you ever want to ask me about how I use it, glad to share all of that. So be sure and check that out. And also, as many of you have heard me talk about before on the podcast, I'd love for you to learn more about Mental Health Wear TN. Mental Health Wear TN.com. It's an online store that my friend Ashley has put together. Ashley and I have had a great relationship over the years. She was one of my wife's caregivers before my wife passed away, and I've helped her kind of set this up in helping her live into her passion for mental wellness and also addiction recovery and all that goes with that. So be sure and check it out. mentalhealthweartn.com. Lots of cool swag there, t-shirts, sweatshirts, and she can customize most anything that she's got in the store. So be sure and check that out. And also, real quickly, before we get to my conversation with Joe, I'd love for you to hear from one of the members of the PsychCraft Network, along with the sponsor of our podcast, TherapyNotes.
Hey there. If we haven't met, my name is Lisa Mustard, and I'm the person behind the scenes of The Therapy Show with Lisa Mustard, a podcast where I interview seasoned and knowledgeable talk therapists from the counseling world to glean valuable insights, techniques, and tools that you can apply to your practice and your life. Plus, you can also earn continuing education contact hours from some of my episodes. So to learn more about the show and get your first continuing education contact hour for free, head on over to my site, lisamustard.com.
Ready to upgrade your practice from a rusty bicycle to a shiny new sports car? Buckle up, because TherapyNotes is here to turbocharge your journey. It's the comprehensive practice management system you've been craving. Equipped with everything you need to navigate patient records, schedule seamlessly, host remote sessions, craft detailed notes, and tackle insurance billing with ease. And guess what? It's your trusty sidekick, available whenever and wherever duty calls. Picture having more quality time with your clients, all thanks to this digital assistant that never clocks out. Here's the kicker. It's Gordon approved, so you can trust it's the real deal. Bid farewell to paperwork headaches and embrace a new era of efficiency and top-tier care. Ready to level up your private practice game? Swing by practiceoftherapy.com/therapynotes and punch in promo code GORDON for 2 months on the house. Enjoy the show.
Well, hello, everyone, and welcome to the podcast again. And I'm really excited for you to get to know today Joe Feldman. And Joe and I have had a little bit of a conversation, but I think you're going to find him just fascinating, particularly the advocacy work that he's doing around mental health. So, Joe, as I start with everyone, tell folks a little bit more about yourself and how you've landed where you've landed.
Great. Well, thanks, Gordon. I really appreciate your invitation to talk with you today. So I got into this world of advocating for mental health care access, not on purpose. Some years ago, our daughter required some significant care, specifically residential care. And my wife and I, working with her psychiatrist, found a suitable program for her, and she entered that program. And I'll say she got the care that she needed from that experience. Not long into her time in residential care, we were, I'll say, quite surprised to get a message from our insurance company that her care was not going to be covered, that it was not medically necessary. And I had been tipped off by a friend of mine who worked in the health insurance world that this is a possibility, but I still was surprised. I just couldn't imagine that news would come from the health insurance company that I'd worked with for a long time and had, I'll say, grown accustomed to not worrying about. So they were wrong. The care was medically necessary. And over the course of her treatment, my wife and I dipped into our savings and we covered it ourselves. And meanwhile, documented how our insurance company was dealing with us, how they identified a third-party psychiatrist to opine on our daughter's situation, how that third-party psychiatrist didn't listen to her therapist and documented a description of her status that was just completely incorrect. And after we were unsuccessful with 2 appeals, we sued our health insurance company in federal court, and we won a judgment, and they paid what they should have paid for in the first place. So through that whole experience, I became exposed to this world of health insurance companies standing in the way of mental health care and substance use care for that matter. And it really, I'll say, struck a nerve for me in a way that I had learned some things that were, I'll say, a little bit of luck and a little bit of who I happened to be talking to, people who had experience in this area, that made it possible for me to be successful on behalf of our family. What I also learned is that the vast majority of people have no such resources. In Chicago, we like to say, do you know a guy who knows a guy who can get something done? And that happened to work for me in this case. Most people don't have a guy who knows a guy who can help them figure it out. And so I have been involved in advocacy for about 7 years, helping, I'd say particularly at the point of crisis, helping clinicians and family and patients push back. And most recently, so at the very beginning of 2024, I launched a new nonprofit called Cover My Mental Health. And that's what I'm totally focused on now. As my wife would say, I'm failing my retirement from my paid career and doing something that I'm just super passionate about.
Well, it's certainly not some wonderful work from what I've read up on it, and was looking at your website before we started recording. And I think I know, just being in the business for as long as I have, particularly being a insurance-based practice, it's something we're coming up against more and more, and it's really disconcerting. I mean, just thinking, that there, particularly some of the tactics that are used by insurance companies to keep from having to pay a claim. And just even for me personally, last year I had trouble with just a medical procedure for the same reason, in that they were saying it wasn't medically necessary, even though it's something that my doctor wanted and felt like I needed to have. And so, yeah. And so it's just, I think we're probably seeing more and more of that across the board, unfortunately.
Yeah, I think that's exactly right. I think the notion of medical necessity can be, I'll say, a little bit confounding to trained clinicians, because medical necessity is not a medical term. It's a legal term. And I had a conversation back in the summer with a psychiatrist who runs a residential program. They offer a variety of levels of care, from psychiatry down to frontline therapists. And he said, in medical school, we're not taught about medical necessity. We're taught about safe and effective care, generally recognized standards, and do no harm. And those should intersect completely with medical necessity. It just doesn't always work that way.
Yeah. Yeah. Well, I know that one of the things, and just looking at your website, and I just want to say thank you, Joe, for putting the time into this, because it's, there's so many, as we know, many of the people that are listening who are clinicians have seen the heartache of people needing help, but just will keep themselves from getting the help they need because they can't get it paid for. And yeah, so Tell us about your website and the resources you've come up with and just kind of the work that you're doing now to help people.
Sure. So the idea of Cover My Mental Health as an online resource came out of a conversation I had with a friend of mine just a little over a year ago. She runs a clinic, and they do a lot of care through intensive outpatient and partial hospitalization. And she called to tell me that one of the insurance companies that was important to her patient base was going to pull coverage for telehealth. And through the pandemic, many people found that telehealth could be a really effective way of accessing care. And it could be whether the only way or complementary way. She was extremely concerned. And she said, are you hearing anything about this? And I'd read about the news, but I hadn't looked into it at all. I hadn't started the company yet, the nonprofit. And so I had a look, and I found that several of the big advocacy organizations like the American Psychiatric Association and the American Psychological Association and National Association of Behavioral Health and a number of others had sent a letter to the CEO of this healthcare company to say, basically, don't do this. There's no reason for you to change your policy about telehealth. It's really important. So I went back to my friend and told her about this letter. And I said, I think it's great that this letter went out. I'm wondering, though, do you have parents of patients of yours? Most of her patients are teenagers or young adults. Do you have parents of patients who would write a letter to the CEO of this insurance company and say, you are hurting my son or daughter and our family, and there's no reason for you to change our access by disqualifying telehealth? And so she immediately said, yeah, I can think of a few right away who would send a letter like that. She said, we'd have to tell them what to put in the letter. And then she said, actually, Joe, we'd have to write the letter for them because that's what's going to cause them to take action. They're in crisis of some kind, and to give them one more task is just too much. And that's when this light bulb went off for me, that having template letters and scripts and worksheets that can be immediately used when someone is facing an obstacle from a health insurance company, that is a big idea. And so I did a little bit of market research. So in the course of my, I'll say, salaried career, I did a lot of work with launching new businesses and new technologies. And so I had an idea of how to think about, if I have a value proposition, who are the customers and who are the competition, and what does the marketplace look like? And I had never run across anything like this idea. So I did some homework, and I talked to a number of the leaders in mental health care advocacy. And what I learned was no one's doing this. And a few people had thought about it. It had never been done. So I got to work putting the resource together. A lot of my own expertise and experiences there. I'd say most of what I've done is bring together the ideas and the competence of a whole range of litigators and appeals experts and clinicians, former insurance company executives. I'd say some marketing people to help think about straightforward communication. And the idea is people will come to the website and they will, first of all, they'll be encouraged right on opening up the website, which is www.covermymentalhealth.org. They'll immediately look at the website and think, I can do this. This looks like a website that's here to help me. So no legal jargon, no, three-part question about who, what regulatory agency governs the plan you're in. Is it employer-based, blah, blah, blah. None of that. We get right to a button for example, denied, not medically necessary, which is a very, I'll say, a too commonly found obstacle. Another button is no in-network provider. That's a huge issue that's getting an increasing amount of press. And then there are a couple of other buttons as well. And the idea is someone that comes to the website, sees those buttons on the homepage, and by going to the next page, they will find resources that they can download And I like to say that we deliver two things: encouragement and a resource you can use this afternoon. So resources that people can get started with right away that are incredibly accessible.
Yeah, that's great. That's great. So typically, what's the process when, say, somebody is? I'm thinking about it maybe from the clinician standpoint, but also the patient standpoint of what's the process people generally should take if they are denied for, non-medical necessity or whatever. Yeah.
Sure, sure. So, so I'll describe what I think of as best practice, and then I'll try to get, I'll say practical in terms of where folks might get started. So best practice, I would describe as, and this is based on conversations with, again, clinicians and litigators and appeals experts. Best practice is when an insurance concern is on the horizon. So that you may not even have had a denial. However, the thought is going through the mind of the therapist or perhaps the patient or their family that I wonder if insurance is going to cover this because it's different. It's a higher level of care. It's a more intensive level of care. For example, moving from outpatient to intensive outpatient or to partial hospitalization, or even from I'll say a general practice family doctor who is saying, I really think you should go see someone about an eating disorder. That's an opportunity to provide the patient with a medical necessity letter that documents a clinical decision that's been made, and specifically a decision about what care is medically necessary. And those letters can be provided at I'll say at any change in level of care that may be a time of risk for an insurance company to say, well, maybe that's not necessary. Certainly when there's a denial for not medically necessary, that is, I'll say, an obligatory time for considering a medical necessity letter to document the clinician's expertise and competence, the standards they're applying in their decision-making.
Yeah. And so typically with that, what success have you seen with those kinds of letters for people?
Sure. So I'll say first, from my own experience, medical necessity letters matter, and they've helped me and my family to, in the case of care that our daughter needed, win a federal lawsuit. So I'm not suggesting at all that lawsuits are a good way to go. In fact, I'd say they're a terrible way to go. It's a very time-consuming process. We required care for our son, and we had a medical necessity letter, and that denial of care, also for not medically necessary, has been partially overturned. I'm still, let's say, that's a project that's not quite done yet. I think one of the great stories that I heard was from Michael Grote, who runs the Lindner Center of Hope, which is a pretty intensive residential program outside of Cincinnati. His story is on our website, by the way. And he told me that he had a patient with a need for residential care, and the insurance company told him, as the clinician and the family, that there were no more approved days for inpatient care. And Michael told me the story about how he took the medical necessity template letter that was in an article that I wrote actually 3 years ago, and he went back and grabbed that template. The version that's on our website now is, I'll say, a new and improved version. It's been enhanced a little bit. The guts of it are the same. So Michael said, I remember having read the article from summer of 2021. I pulled it out. I used that template letter, and I used it to I'll say, fill in the details of this particular patient. And he said the insurance company stood down, the additional days were approved, and the course of residential care for this patient was approved, and the claim was paid. Mm-hmm. And I've heard from litigators that medical necessity letters have worked for them, either in litigation or to accelerate a settlement. And I've also heard from former insurance company executives that a medical necessity letter is, I'll say two things. It's a document from the clinician that explains their decision-making and their competence. And it's also a pretty clear indication that the member, so the family member who has the insurance policy, isn't just somebody who's calling up and upset and is sort of pounding their fist on the table. There's someone that has leveled the playing field. And when the insurance company says it's not medically necessary and they don't tell you why, and your document from your clinician says, I'm Dr. Feldman, so I'm not a doctor, but I'm Dr. Feldman. This is my training. This is my experience with this patient. These are the standards of care that I've applied in this particular case. And this is my clinical judgment about the medically necessary care. That levels the playing field with the insurance company about how a decision about medically necessary care should be made.
Yeah, it's interesting the way that the system is set up, in that it seems that, as you're kind of alluding to, is that insurance companies are hoping maybe that if they deny the claim, nobody's going to go to the extra trouble to try to fight that. And so that they end up not having to pay money out because of that. And yeah,
I'm going to go with it's more than hope. It's a business practice. That's another story that really rang true for me of another friend of mine who's I think a psychologist by training, and he runs the behavioral health unit for one of the hospitals here in northeastern Illinois. And he told me about one of the psychiatrists who works on his team coming to him and saying, this insurance company has just worn me out. I've tried to get the care approved and it's just not happening. And I just can't spend any more time on it, notwithstanding the fact that it's the right clinical decision. I have other patients to take care of too. And my friend said that he told his colleague, so on the one hand, I understand. And on the other hand, you will be a marked man. You will be known as a pushover and someone who will not sort of last long in a conversation about who's making the clinical calls here. And so he said his colleague, I'll say, got his energy back up and his muster to go back and push back on the insurance company about what care is or is not medically necessary.
Right. Yeah. Unfortunately, I've had some run-ins with the insurance companies, as I mentioned earlier, not only with my own an issue I had for myself, but my late wife, when she was getting treatment for cancer treatment and, all of the things that went through that. I remember one time she had some extensive back surgery because of a fall, and the insurance company wouldn't approve her going to a more intensive rehab. They were just saying it wasn't, but they were looking for the cheapest way out. And I dare say if I had not pushed with that, she would not have gotten the type of care that she needed. I think they were looking at numbers, her, fact that she had cancer and just all of the other issues. But I guess the thing that got to me is that that's not a decision for the insurance company. That's a decision for her doctor and her family to make about what kind of care that she should be getting.
Right. Yeah, I think, let's say this healthcare in our country is complicated. I think that's a pretty safe statement. And I think the idea of, I'll say, unlimited care for an indefinite period of time for everyone is also, that's not realistic. That's also not what we're expecting. We're expecting our, I'll say, basic needs are going to be met. And basic needs can be as simple as I've got an issue on my skin and I need to go see a dermatologist and get the right treatment. And basic can also mean I have a complicated cancer and I need a very particular and maybe costly hospital stay and chemotherapy and radiation and other care. And that's what basic care is. That's not heroic. That's really, I'll say, that's how we should treat one another.
Right. Right. Yeah.
And I think that's, yeah, a friend of mine says, we know better, so we can do better. And I think there's a lot of wisdom in just applying common sense. How would you treat, there's a golden rule aspect to this, right? If your wife needed physical therapy associated with a back issue, that doesn't sound grabby.
Right.
That sounds like you and she want to take care of a really reasonable health issue.
Right.
And you're not asking to be flown halfway across the country to get it. You're talking about, I'll say, driving into town. That's not hard. I don't think that should be a difficult decision. And, I'll say in a way that's part of the mindset that I've tried to keep front and center with the development of Cover My Mental Health, is to make it as absolutely straightforward as possible, to make it as commonsensical as I can, that when you buy health insurance, your expectations are completely reasonable, that there should be a network of clinicians available to you. You should be able to access them nearby. And nearby can be I'll say, in the eye of the beholder. I don't really quibble with, is nearby 5 miles, which, maybe in suburban Chicago is not a big deal, or in northeastern Tennessee is not a big deal. If you're in Manhattan, 5 miles might be an hour. So maybe that's not the right measure. But nearby is something we can, I think, wrap our minds around. And soon is another concept. Soon is a reasonable expectation. And soon could be, I really need help today. And soon could be a couple weeks is just fine. But 6 months is not soon.
Right.
Or next year is not soon. Or can't find an appointment at all. That's not soon. So just the idea that your common sense expectations should be met. That's what you buy insurance for. And here are some resources that you can use, including steps that you can take that insurance companies might well respond to. So no guarantees, but they might well respond to steps that are different from what they tell you in your insurance policy. And that's really what we're totally focused on.
Right. Well, Joe, this has been a great conversation, and I've got to be respectful of your time, but tell folks again how they can get in touch with you.
The website is www.covermymentalhealth.org. If you have questions, you can email me directly. My email address is joe@covermymentalhealth.com. And I certainly welcome inquiries about the website. Certainly welcome folks to have a look and to share the website. One of the things that's really important for us is to, I'll say, spread the word. And so we really invite therapists and provider organizations to think about putting a link on their website that has Cover My Mental Health. And at the bottom of our website is a link to what's called our collaboration toolkit. And that toolkit has really a whole smorgasbord of resources that can be used to help spread the word. Like there's a text that can be used in a patient newsletter, or logos or other images that could be put on a website. And those are really valuable ways that I'll say that you can help us to help even more people. And Gordon, I really appreciate your time and your questions, and let's go out and make sure people get access to the care they need.
Absolutely. Well, Joe, I hope to have you back on the podcast, and I wish a lot of success with this. And I know you've got my wheels turning and thinking about things in a very positive way. Well, a big thanks to Joe for being on the podcast, and be sure and check out his website, covermymentalhealth.org. He's got some great templates on there, as we talked about, of just some form letters that you can fill out in helping people get their coverage approved for mental health services, and also just really kind of pushing back with the quickness to offer a denial of an insurance claim. Unfortunately, it's how the system works. And insurance companies, unfortunately, look for ways to not have to pay out. They want to get our money on the front end, but they don't necessarily want to pay out. And making sure that people can take advantage of the coverage that they're paying for. So be sure and check it out. www.covermymentalhealth.org, and there'll be links here in the show notes and the show summary for all of that. Also, before we go, I'd love for you to check out the Full Focus Planner as we start moving into a new year. You can check it out by going to practiceoftherapy.com/full-focus-planner and check out the landing page that I've got there that tells about the Full Focus Planner. I absolutely love mine, and we'll plan to continue to use it for years for years to come. It's just a great product. And also, big thanks to our sponsor of the podcast, TherapyNotes. You can find out more about them by going to practiceoftherapy.com/therapynotes. And be sure and use the promo code just Gordon, Gordon, to find out, to check them, try them out rather for 2 months for free. I am constantly amazed and just really pleased with all the improvements that they continue to make with TherapyNotes. I use it in my practice, and it's absolutely the hub in which we run our practice. So be sure and check them out. practiceoftherapy.com/therapynotes. Well, take care, folks. Hope you have a great holiday ahead for those of you celebrating. I know this can be both an exciting time of year, but also difficult one for a lot of folks. But hope you're having a good holiday, and look forward to being with you in the new year. Got lots of great new episodes planned and lots of things coming down the pike with the practice of therapy. So be sure and check it out. Just check out the website, practiceoftherapy.com. And take care, folks. And we'll be with you again next week. Oh, and do take time to follow us or subscribe to the podcast wherever you might be listening to it. You've been listening to the Practice of Therapy podcast with Gordon Brewer, part of the PsychCraft network of podcasts. You can find out more about the other great podcasts in the network by visiting psychcraftnetwork.com. And if you haven't done so already, please visit us at practiceoftherapy.com and get your free private practice startup guide, along with a lot of other great resources and webinars and free things just by visiting. Also, be sure to follow us wherever you might be listening to your podcasts. This podcast is intended to be educational in purpose and is not intended to give legal, accounting, or counseling advice. If you need a professional, find the right person for that.